Hi everyone.
Welcome to our podcast, Health Data Decoded.
I'm Ed Hill.
And I'm Samuel Ball.
We are researchers working at the University of Liverpool in health data science, and we are part of CHIL, the Civic Health Innovation Labs.
CHIL's an interdisciplinary team of researchers, NHS staff, local government and charities looking to use data and artificial intelligence to improve health outcomes in a responsible way.
This work, as well as bringing innovation and improvement to health, can also help with our social well-being and the economy.
In this podcast, we'll be interviewing collaborators, researchers and professional support staff within CHIL to better understand what they do in their roles to improve health outcomes for the local area.
We'll be delving into questions such as what are their day-to-day tasks, how did they get into the role that they currently have, and what advice would they give if you are interested in getting into this area of work yourself.
So join us in our journey to understand better how we can use data to tackle global health challenges and local ones within the Liverpool City Region.
Hi everyone, and welcome, and thank you for joining us in this episode of Health Data Decoded with me, Ed Hill.
And me, Samuel Ball.
And today it's great to be joined by Annemarie Naylor. So, welcome,
Hi
Annemarie.
guys, lovely to be here.
Hi, Annemarie. So you're Director of Health Tech and Innovation, and you're also kind of leading the CHI Zone initiative. So there's a lot of words there, really. Do you mind just unpacking them and telling roughly what all of that is about?
For sure. So I think I have a university-wide role in terms of being the Director of Health Tech and Innovation Growth, which means essentially acting as an ambassador for the university, promoting our kind of efforts to commercialise some of the work that academic colleagues undertake, but also trying to support colleagues who reach out to industry partners who might want to work with us and benefit from our expertise. And then on a more kind of internal facing, to some extent, role is a kind of programme director role. Rolled into that, which is leading our Civic HealthTech Innovation Zone programme.
That's super. So that's already showing just a vast amount of responsibilities that occur across that range. And in terms of how you entered your current role, what was your journey to that, and other experiences you're willing to share on?
So I normally describe myself as a hybrid professional. I'm not sure what that means. It probably means I'm a Jill of all trades. But essentially, I've come via the public sector, third sector national service designer and programme manager role. I've set up and founded and directed my own company in a data and tech for good space, working with community organisations. And then spent some time as well as a group director of a large corporate. So I've come across all three sectors as well as being a startup. I hadn't tried a university full time, so this is my first time in the higher education sector. So that's kind of how I find myself here. And I guess the golden thread between all of those kind of activities has been either economic development led by the state and administering that and managing those types of programmes, or bottom up, working with communities to do community-led regeneration and support that. So I've worked with every local authority now across the country for my sins. And I've also had the privilege and pleasure of working right across central government, as well as a short stint within the Cabinet Office. So I come with extensive public sector experience, as well as that kind of third sector kind of bottom-up experience.
I think that's
immense.
immense.
I mean, it's huge, isn't it? So obviously a huge range of experience. So from my perspective, I mean, we've worked or are working together on the CHI Zone initiative. So this is about driving innovation, bringing jobs to the local region through the health tech innovation. So I mean, we could go on for hours about this project because it's frankly massive and there's so many different strands. Do you mind just giving like an overview for this project and why it's important for the local area?
So first and foremost, the Liverpool City Region, the combined authority, have secured £160 million from MHCLG over the next 10 years to establish a health and life sciences innovation zone, and that's to complement the existing Freeport provisions that we have here in the City Region. All of those things are geared to clustering businesses of similar types together over time and building on existing assets across the City Region and within its higher education institutions, but also in its kind of innovation assets. And over time, we know that if we cluster businesses of similar type, they attract people to stay longer. Graduates that we might generate within the university will stay here longer because they see long-term career prospects moving between businesses of similar types with similar roles. We know that those businesses will thrive to a greater extent because they'll share spillover knowledge and kind of benefits between them as they collaborate. And clearly here in the City Region, there's a real need to upskill and ensure that we've got our local population plugged into any of that business growth, as well as to make opportunities for our kind of young graduates as they leave our higher education institutions. So overall, the idea is that there's an intrinsic link between health and wealth. And I guess that's what the central kind of proposition is of place-based regeneration initiatives like this.
Yeah, so it's really interesting because I think this. You traditionally have had cities around the UK who are experts in different areas. So I know like Leeds was known as kind of this fashion area, and obviously as the economy's developed and we've kind of brought technology in, I think there's been a slight centralisation into London, and maybe in certain areas have picked up. So I know Manchester is like a massive tech hub. I don't think people really know what Liverpool is special for. So do you have any like examples of where Liverpool and the City Region is like a massive expert in the sector?
So I guess first and foremost, we're the first place where we found public health, and so privileged to work within the Civic Health Innovation Labs here at the University of Liverpool, headed up by our director, Professor Ian Buncan, who has that job title effectively, so shares with W.H. Duncan's chair. And so we have a long-standing tradition of public and population health. I think beyond that, the University of Liverpool itself benefits from a range of facilities, whether it's training people to become medics in a pure health kind of fashion for people, but also our veterinary science department, dentistry, and it's not, the majority of universities can't offer that range of opportunities to upskill populations. And then beyond that, we've obviously got a clear manufacturing kind of prowess within the region that's linked to the kind of health industry as well. And so the cluster is always there. There are about 300 businesses linked to health and health tech and life sciences at the moment in operation across the City Region. So the aspiration is obviously to grow that and create in and around 8,000 new jobs over the next 5 years.
Wow, I mean, that's like such an immense vision. That's going to be brilliant to see this arise in upcoming years. And as you've outlined, the fact there's kind of like a generational plan for like developing the new talent and helping them get the skills, but then also move into the workforce and contribute and become the leaders themselves in the future. I mean, that's really cool to see. So
it's a really exciting opportunity, and I'm particularly proud that the programme that we've secured funding to deliver over the next 4 years, the Civic HealthTech Innovation Zone, this comprises of a series of buckets of activities, activity strands you might call them. Some are academic-led, but for good reasons. We know we've got big brains in our NHS and in our care services, so we're looking to professionals to also seed what we've called collaborate to innovate opportunities, a bit jargony, but essentially sow the seeds for 1,000 flowers to bloom. So where are all our smart and clever people or people with lived experience who have first-hand knowledge and understanding of what really kinds of solutions would work best? So we're really proud in the first 8 weeks of the programme. We've reached out and called for citizen entrepreneurs from across Liverpool communities. We have 8 places to support people to develop health and care businesses and to provide them with any tech support or expert academic input they might want. And we were overwhelmed to receive 200 plus applications with some fantastic broad-ranging kind of propositions from them. We've also reached out to our care sector locally and established the first provider test bed for social care providers in the country. And we're looking now to engage industry partners who might want to work with them to solve the challenges that they face, which I think are replicated up and down the country, but also across the Western world by dint of the ageing society. So I think we have the potential to deliver massive impact. We've also got some industry partnerships that are very exciting. We're still under wraps, but soon to be announced. And so really keen to work with business, with the third sector, with our communities, as well as with professionals and academics across the programme.
That's it. And it's like more than 200 applications to that scheme. I mean, that shows so what you're offering, therefore, it's like there's the need there, the want there, the demand is like definitely
absolutely
there.
Absolutely, yeah.
Yeah, it's crazy, isn't it? Because like, I think we've kind of got. I mean, I love Liverpool, and I think the people here are amazing. But I think you're right in that saying that too often. I mean, when I graduated from my PhD and my bachelor's, when you look for jobs in the area, for mathematics or AI, there was very little available. All the jobs were in Manchester or London. And I think it was really sad because you saw a lot of local people who stayed in Liverpool and obviously wanted to give back to the local economy through studying here and then getting a job here. But there just weren't the opportunities there. And I know loads of people have moved down to London, and then they've kind of done their time there, and they've obviously built a professional network, and then they've moved back up, and it's difficult because you've obviously got people who are very successful in Liverpool, but there's not that like middle section of opportunity of like companies that are employing local people.
It's kind of chicken and egg. So
Exactly,
companies like to go to places where there's a pool of existing talent, and existing talent moves if the companies aren't there. So we need to do those two things in parallel, and we need to attract, I think, top talent to the region, which is perfectly eminently feasible, given it is a wonderful place to live, and a testament to that as I've moved here for the last 18 months, and it's fantastic. But I think there's a kind of sense of you also need to upskill your own people and raise the aspirations of a local population, the awareness of the kind of opportunities that these kind of organisations or businesses would harbour, really. Yeah.
It's every level, isn't it? It's every level.
Yeah.
Cool. So you mentioned about engaging with so many different organisation and entities. So in terms of, do you have a typical day-to-day, and what might that entail, or is it just very, very different what happens from one day to another for you?
I think it suits me greatly that my days are never the same. They're very varied, and so lots of internal and external senior stakeholder kind of relationship management. Partnership development, really key, working with partners across the city region but further afield to bring in different kinds of arrangements that have not necessarily been here before to kind of grow our potential impact. There's a fair bit of programme oversight, so we'll be delivering in our programme 15 to 20 discrete projects of varying complexity. We'll be looking to upskill around 1,000 people through those projects. But we'll also equally be looking to work with over 125 entrepreneurs and individual businesses in the next 4 years. So quite broad-ranging, complex kind of throughput of participants in the different aspects of the programme. And then I suppose there's a fair bit of being a team leader recently, which is really nice since we stood up the team. So I benefit from working with, at the moment, 15 fantastic colleagues who come from broad-ranging backgrounds across different sectors with real different skills, from design through to business engagement, market intelligence and research, and comms and marketing, and all the different things that you would imagine you might need to engage and support the various entrepreneurs and enterprises that might come to work with us. And obviously behind us an army of academic experts that can just offer the full range really of expert input that any business that's trying to carve out a particular USP or niche would want to find.
Yeah, I think that part's particularly interesting. I mean, I know that I've sat in meetings with other groups within CHIL that have developed something quite impressive, technically helpful. Obviously, there's a need for it in society, but there's always this gap between academia and almost like society as a whole. And how do we get something that is technically clever, there's a need for it, and then actually get it to help people out and deliver? And one of the routes for that is through business, essentially. Is if you can spin out a company and say, let's sell this thing, that it's kind of like the clearest route to go for that kind of tech, because there's an existing system of, you've got a product, you sell the product and you make money to then reinvest into the R&D process. So yeah, I think having it's not just like this exists in a vacuum. It's you've also got, with that team of researchers, they're also benefiting from having the entrepreneurship team going the other way as well, which is really interesting.
Yeah, I mean, I'm very privileged to sit on the university's enterprise board, so I get first-hand kind of dibs listening to pitches from academics with their fantastic leading-edge ideas and the IP that they want to commercialise, whether they want to spin it out or find an industry partner that they can license that technology to, which is, if there's a controversial point I could make, probably we go between these things every 5 to 10 years as a sector, I think, is my kind of experience of talking to people now. So sometimes the emphasis on spin-outs more, sometimes more on licensing technology, and it's horses for courses. I think we have to be clear about how many academics want to run a business as well as be an academic, and how many businesses are capable of licensing and making full use of some of the types of technologies that might be developed without that academic expertise long term being part of the board arrangements or governance and expert kind of mentoring and consultancy arrangements. So the team, we're looking inward to people who have ideas they want to take out into the world, but I'm also keen to make sure that we work with other parts of the university that are already geared up, like our RPI team, to bring in industry partners who say, I've got a question, how can you help me solve this? And then, so in a sense, it would be a bit of a downgrading of me to say this of the team, but we're a bit of an official dating service, I hope, going forward between people with particular health tech or engineering prowess and expertise, and how we connect their ideas and industry back and forth as makes best sense, really.
Yeah. So obviously there's a lot of project management in your role and managing people. We kind of always ask, like, is there any other stuff that you do in your role? But I almost think a better question to be asked would be like, what's the weirdest responsibility that you've done during your time here?
The weirdest. I think in terms of just in terms of the things that's demanded of me, I think my line manager asked me when I first started and said, I'm looking for a political ninja. And I think, I'm not sure if I've managed that, but I think certainly, with a small p, so effectively, can you knit together very complex relationships across multiple sectors, academia, health and care, but also obviously local government and then communities and industry. So probably having the Jill of all trades background is quite useful because I can translate between the various languages and ways of kind of presenting different types of information and ideas quite well. Probably also I've become something of a process junkie. So obviously you go through a period of needing to justify the programme that you've designed because we are spending and responsible for public money, which is scarce and important and absolutely critical to the success of the city region going forward. So we take our responsibility very seriously, and so we've gone through a period of making sure that our proposals are really value for money and will deliver exactly what's needed. And now on the flip side, as we begin to stand up the programme and roll out the different projects in earnest, I'm beginning to learn about the university's process as an academic process, about research ethics, about how speedy we need to be very agile in response to industry, and quite, I think, ambitious targets that we've set ourselves to deliver impact, and how we make that work with an organisation that has been established largely to follow more traditional, so most of what the university would follow the traditional path of looking for research funding, which has a lead in time and perhaps single projects with single ethics requirements and things like that, whereas we have projects that have multiple industry partners going to flow across them. So how do we turn that into a kind of efficient engine is part of my kind of enjoyment, I suppose, from the role as well. Yeah. So
I can see that's like disrupting the existing system that's there, but that's needed given what the vision is to accomplish.
Bending and blending rules that seem rigid to do agile things. Yeah, that's hopefully what we do, and I hope we do that respectfully, working with a range of fantastic colleagues across the university who are very excited when I explain what we're doing and it's completely different. The response ordinarily is, that's refreshing. We don't normally get asked that question. Let's think about how we could do that. So we've got very can-do colleagues. It's brilliant.
That's great. And so basically, you've asked a question, so it's not a question they've heard before, so it's such that, what can we do to make this happen? So like you say, it's again breaking down these barriers and making progress. And a couple of other things that you remarked on there. So this translation of information across different audiences. This is something that's come across in our other episodes as well, and being a perhaps surprising aspect, something people hadn't really thought they would need this skill or hadn't really thought about it before, but then as part of their job this naturally occurs to broaden the impact of their work. And so it's great to also then hear you remark on this as well. I mean, with your role, the fact you are interacting with all these agencies and bringing them together.
Things that you learn that are really different. So coming from the civil service kind of public sector background and working with public money for a long time, I think on occasion it's been levelled at me that I might be the Prince 2 person in the corner or the accountant. And instead of talking about projects and programmes, people here talk about work packages, which to me are the same thing, but it's a completely different language. And it's interesting also to see that the framework of documents, the sort of run through that you see many times over in my kind of career trajectory, you'll see 5 questions asked most of the time. So they say, why are you doing it? What will you do? How will you do it? Who will do it? When? And how much will it cost? And when you come into university, all those things are missing to begin with. Everyone focuses, it seems to me, working with engineers at least, on the how. So the method, the secret sauce, the special way I know how to do that is what's prized. And I often say, but why are we doing that in the first place? So I might sound like the duff civil servant in the corner. So I'm quite interested in the kind of the real focus on strategy or strategy creation, and whether that's useful or not is a point to be debated out in the public sector, but versus this kind of, and then when you obviously go to the private sector, and I work with a lot of academics increasingly to develop pitch decks, to go and talk to them about, here's my idea, how might we work together and collaborate, and I look at the story that's told about how exciting my cool thing is, but very often a real nervousness around, how do I say that will cost this much to do it, my expertise is valuable, this is what we're looking for, and this is the benefit to you. So actually for the academic community to be able to translate to the business or the industry partner why you should work with us because this will help you in these ways, I think is a real skill that we need to hone over the coming months and years through the programme. Yeah.
Sure. Great.
Yeah, it's interesting, isn't it? Because I think that those questions, in a way, should roll into each other a lot more than they do. So, from my perspective, when I'm doing, say, analysing MRI images for clinicians, really what it should be, and this comes into patient involvement as well, is we should be asking the clinicians why should we be, what the problems are and why should we fix them. Whereas I think culturally we've got a really bad problem of looking at shiny new things. So, for example, large language models, and just saying, how do we apply this to a problem without asking the question, does that make clinicians' lives better? Does it make it cheaper? And is it easier to use, for example? When I think research should kind of be a bit more trying to solve real world problems. But I think that's kind of like, there's a huge spectrum, isn't there, from blue sky, I'd say mathematical, pure maths, like topology stuff, and it does trickle down eventually into useful stuff, but there's some translational steps there in how can we take it to market.
So I think there's two aspects to that. So one is, I wonder if part of the future role of some universities across the world, not just in the UK, is to have much more of a civic focus, and I'm delighted to be based in one of the two most community focused kind of and business focused kind of units in the university, and working closely with the other. Our virtual engineering centre. So I think there is a kind of sense of they're very applied, immediate solutions to industry-generated questions or to problems that our NHS or care services and local government identify, where a tech solution or health tech solution could support that kind of delivery of solutions. I think there's but you still have that moment where Steve Jobs stands up and says, you didn't know you needed or wanted an iPhone. And I'm like, if you don't dream, if you don't have an idea of how it could be completely different, how will we ever change things? So my own personal passion is kind of seeing if I can get into a position as a non-engineer and a poli-sci graduate a long time ago, is to a point where we can look at the role of robotics in relation to care, largely selfishly, because in 20 years when I retire I don't have children, and at some point I'm not very good at cooking anyway, but generally I'm just thinking, for those basic menial manual tasks that I don't like doing now, I won't be able to for long periods, and there's no one to help me. So I have no problem with the idea of robots help care for me, or around the house. I think when you say that to many people, they feel like it's the antipathy of care. It's like the opposite, and it should be a very human experience. So I'm very keen to think, well, how do we take people on a journey to explore that and say, in what cases should it be a person, or could robotics and automation kind of help? If we don't dream like that and ask people the question and take them with us, then we can't have that new thing, a new way of doing something in the future as new technologies, particularly robots, come on stream, and we'll be there in the next 5 to 10 years, I think.
Yeah.
And so going from the small iterative steps to these paradigm shifts which can happen within the science and research and development.
Yeah, it's interesting, isn't it? Just there's a combination of both as well, in that you kind of need both to happen.
Yes.
Yeah, but I mean that's a huge conversation to have, I think, isn't it? Of kind of direction of research. Yeah. So just to finish, we ask everyone this question. We want to get more people involved in health research and in this case innovation. So my question to you would be, if people, what would you say to people at home if they wanted to get more involved with health tech and innovation?
So if I focus on innovation, so I've been a director of innovation in various roles over time. I've also had some strange titles I've given myself as a self-employed person, but I think there's a kind of it seems to me that some people see innovation as, I have a really cool idea, it's a special idea, and the idea is what's prized. But in my roles as Director of Innovation, what I've taken away from those is that it's not to have the inventive idea, it's actually to be the person who can take people on a journey to say, let's do something a bit different, or let's try something a bit different, or let's change the way we do it. So this idea of culture change and taking people on a journey to say, take a risk, deviate from the existing or established path. I think that's the job of somebody. The excitement is to take people with you to try new things. So we do need people that invent. They're terrific people. But I think we need people in innovation also that can help take the people who don't invent on the journey to use those things that are invented anew. Yeah.
So thank you very much for sharing these experiences with us today. And so just hearing, and with Kaizone, to talk about tens of projects, hundreds of entrepreneurs, thousands of jobs. I mean, it's going to be brilliant to see this emerge. It's massive. It is massive. So,
it's really exciting.
And so thank you to you and colleagues in the team who are helping deliver this for the region. And thank you for listening and watching this episode of Health Data Decoded. And so Kaizone is on LinkedIn, and CHIL is also on LinkedIn and Blue Sky. And with that, thank you again for joining us, and we hope you will join us again next time.